Welcome to another episode of Out of the Blank Podcast. I'm here with Dr. Ramsay. It's a pleasure to have you back on the show. Thank you so much for joining me to be able to talk about ADHD a little bit today. But do you mind introducing yourself to everyone out there listening?
Sure. My name is Dr. Russell Ramsay. I'm a practicing psychologist, and more to the reason of my being here, I specialize in the diagnostic assessment and the psychosocial treatment of adult ADHD.
We've covered a lot in the past couple times you've been on about ADHD and emotions, a lot of focus on ADHD in childhood, which I think a lot of focus should be on that. But I wanted to talk a little bit more this time about ADHD in adulthood, specifically where you've seen with ADHD diagnosis later in life. I think it's becoming, with more popularity, I would say, in ADHD. More people are getting diagnosed with something similar or getting diagnosed with ADHD. And I know it's important to separate, maybe a misdiagnosis or something like that. But these qualities and these aspects of it, I'm wondering how frequent you've seen ADHD diagnosis in later in life with adults.
Well, I mean, that's been my main gig is with adults, so pretty much 100% of, but more recent data out of the Center for Disease Control, they did their first deep dive into adult ADHD, and these are findings published October 2024. That over the past year, in terms of cases of ADHD, 50% are people who are diagnosed 18 or later, more recently. So, and that would be considered, and these are individuals not diagnosed in childhood. Um, so, which is called late identified. So part of the diagnostic criteria, which I'll do a deeper dive in a little bit, part of diagnosing ADHD in adulthood is going back and assessing for asking about, were there signs and symptoms, many signs and symptoms, if we're doing it by the book, before age 12, even if they weren't necessarily creating problems big enough that somebody was assessed then, but you don't catch ADHD in adulthood. But it emerges at some point in childhood. So that is part of making the diagnosis. And interestingly, among the new data on late identified ADHD, in the group diagnosed by 18 or later, 61% are females, women. So a historically underrepresented group now is more likely to be diagnosed later. And just to round out the statistical geekdom, a lifetime diagnosis of adult ADHD was 8.0% of the U.S. population estimated by the CDC study, and in the last year, 6%. So up to date information. Go ahead.
Why is there such a focus in the beginning, I guess, where it's changing now on males with ADHD, usually like young boys? I've seen memes where people have put like girl with ADHD off to the side, but then it's a boy with ADHD, and like the person that would be called the psychologist or whatever was like heavily focused on the boy with ADHD.
It's a great observation. This will be like one of these sayings that you don't take literally, but it's a guideline. Is that ADHD for boys shows up in the classroom, for girls shows up on the playground. So very often, boys are more likely to at least have observable signs of hyperactivity and impulsivity that are more likely to catch the eye of teachers, in addition to attention problems and therefore the academic problems or behavioral problems that might lead to a diagnosis. For girls, it might show up more in peer relationships, and it can be some of the same things as with boys, not being good at taking turns, playing by the rules of a game. And girls, there's some studies that even when showing signs of hyperactivity and impulsivity, again, school-age girls, it's less likely to be seen as hyperactive or impulsive or as an ADHD symptom than it is in boys. So sometimes these are just patently missed because we don't think about these things as ADHD in girls. So one of the wisdoms about girls and ADHD was that they're overrepresented in the predominantly inattentive presentation, that they don't show the same hyperactive impulsive symptoms. But in fact, they're closer together than we might think, that many girls and women probably present with the combined presentation, but it's just the hyperactive impulsivity manifests differently.
Now, how difficult is it for you to be able to diagnose someone later in life with ADHD, besides looking at their childhood, but just examining, like, let's say they don't have a reference for any experience of their childhood, so the person has to go turn to someone either close to them or just try and find anything that would be some symptoms of ADHD that might have had it earlier than when they're coming to that doctor. But so many people with ADHD put up like scaffolding, I would call it, or just walls to kind of keep their symptoms down and try and function well with the social aspect and kind of be a normal part of society. How do you try and teach those people that those social things they put up that they're probably so used to? I was so used to it. That now that there's this thing that can help you, and then when they take that thing, they realize, okay, I don't have to do all that extra work that I was doing. You don't really realize it because people might have been doing it. I was doing it for 27 years.
Right. The other phrase you'll hear out there is masking. And the first level of masking is actually attempts to cope well. And they can be really unhealthy, staying up all night regularly to catch up on homework. And I'm focusing more on the kids right now and like catching it earlier on. Maybe out and out cheating. I've also heard, and I'm still amazed by, like, at least retrospectively, adults saying, yeah, I didn't hand in a lot of my homework, but nothing ever happened. So, and you're right, there can also be scaffolding put up by loving parents sitting with their children, their students, to make sure they focused on their homework, helping them with it. In some cases, even being so tired because they have to wake up for work the next day that they might finish a project for somebody. Again, just trying to help the kids get through. So with me meeting with individuals in adulthood, now sometimes it is for somebody who was diagnosed in childhood or adolescence and they're looking for continuity of care in adulthood, but I'll still go back and do an evaluation, just because sometimes, not a lot, but sometimes where we go back to things and maybe it wasn't ADHD. There was something else causing attention problems at the time. But generally, and I was lucky, I was at the University of Pennsylvania, so not too far from the Children's Hospital of Philadelphia's ADHD program. So a lot of individuals might have gone through that program first and gotten a world-class evaluation and then came to Penn for follow-up in adulthood. So part of, as I said before, working with adults, part of that who say, I'm not sure if this is ADHD, that's why I'm here. Part of it is going back and asking about childhood. Now, it is going through and doing an interview for the symptoms of ADHD retrospectively in childhood. As you alluded to, part of what will likely be the recommended guidelines for the assessment, like when the US guidelines come out. Also, whenever you can get it, somebody who knew you in childhood, a sibling, a parent, some other relative, whoever, who can also fill out a questionnaire about symptoms, about what you're like in childhood. Now, apart from explicitly asking about the symptoms, part of my interview, just getting the history, is also, and what the line I've used on this before I got into ADHD, and I was still doing diagnostic evaluations for other things, my asking about school and work was, how far did you get in school? Any problems? What final degree did you graduate with? Any problems? And also, what do you do? Any problems at work? Any firings? Okay, let's move on. Now, getting back history from somebody who suspects they might have ADHD, even if they say, yeah, I was valedictorian of my high school class and I finished college in 4 years, I want to go back and say, what was the adjustment to school like for you in kindergarten? Getting used to sitting with other students, listening to teachers, early learning. What was the adjustment to those next few grades? What about the adjustment to middle school? More different classes, more difficult assignments, more reading, more writing, What were in-class exams like for you? What about the adjustment to high school? Same questions if they went on to junior college or even medical or law school. How did you do school? Because even if somebody got through, even going back to primary and secondary school, sometimes people say, I came from a really easy school district or very underfunded school, so they didn't check too much. Or my parents sat with me, or I stayed up late. So it's also the process of how somebody managed things. So then you can see the scaffolding. And on paper, I handed in everything on time, but I stayed up all night. I finished it on the bus ride to school. Somebody said their last assignment as a graduating senior, they arrived to school, hid in, I guess they had a cloakroom or some room where people could hang their coats. They hid in the coat room, finishing their last assignment that they had forgotten about so they could graduate on time. So even leading up to high school graduation, finished on time, decent enough grades, but also what you'll hear a lot of times is I wasn't fulfilling my potential. If I passed, B's and C's get degrees respectfully. Um, but also they go, yeah, I had to scrape by a little harder. It took more time or all those things. And same things in college and college and at other schools, but also similar things in the workplace. People might spend inordinate time outside of work, catching up on work that the employer might say, hey, good work, but it's coming at a cost. So that's how you can tease apart ADHD, even in somebody who on paper, graduated high school on time, graduated college on time. But you can see behind all the efforts, behind the things that usually what happens when they're coming in, going back to the Penn days when we started the adult ADHD program, one group we saw right away because it was just me and Tony Rostein right away. So only some groups on campus knew about us. But it would be the college freshmen or sophomores who fell apart after the first semester or after the first year. Now, that can happen for a lot of students with the adjustment, but here we are talking about it being more persistent and difficulties doing school, including individuals who might quit um, an NCAA sport because they say, I'm failing, I have to give this up, but they were still having difficulties. Um, Another pulse point where people come in is maybe in their mid to late 20s where they say, I'm having problems. I always had problems in school and I still am. I'm in my job and I'm still having the hard problems and maybe losing a job. And I feel like I'm always starting over and it reaches a point where I fall on my face again. And then there's another pulse point, maybe later 30s, early 40s. Um, let's call it midlife, even though midlife might be a little later, where somebody goes, I'm getting by, but I just can't keep up this pace anymore. I'm keeping up at home. I'm keeping up with raising kids, pets, a job, whatever the case may be, but I'm fading. Or there's some change in a profession where things were more hands-on. Now they're more digital, or other duties. Maybe somebody now doing well and getting promoted to a manager, and they go, it's all I could do to manage myself. Now I have to manage other people. Things that finally expose things that have been there for a long time already.
This kind of speaks to what you've already said in the past, but about cognitive behavioral therapy and other forms of treatment, or just things like even taking ADHD medication. I'm going to kind of broad brush it there so you can have a different avenues to choose from because I'm sure it's multifactorial and things. But when you're looking at an ADHD late diagnosed adult, using one of those forms of treatment or medication or something of that sort, what do you see change in their lives and in their career paths? Because obviously, like for me personally, energy level is a little different. Time management's a lot better. Motivation, confidence, better self-esteem. A lot of these things that I feel like a lot of people with ADHD struggle with already because of the fact that for so long they had to repress certain things and they kind of felt ashamed of how they might act in certain situations. So they were called annoying. And usually emotions come up with ADHD. People take that really to heart and they kind of never let it go. So I'm curious, with all these other forms of treatment, what have you seen change in people that were diagnosed later and decided to get treatment for their ADHD?
Right. Great question. And very often the medications and cognitive behavioral therapy, I'll just focus on those two because those are the two with the strongest evidence support. They can work very well together. Um, I'm blanking on the term right now, that some colleagues came up with, um, but medications more directly target the core symptoms of ADHD, the attention, the physical activity, and thereby with those improved symptoms, people are better able to do what they set out to do. And a benefit of the medications that might be a little bit separate is with some of the core attentional features. Like I'll use one example that if somebody comes to me and they say, I'm generally on time, I'm generally organized, but I have a hard time focusing on reading assignments, writing. It takes me twice as long. I get distracted. As a psychologist who can't prescribe medications, I say, I can talk with you about your attentional endurance, um, trying to do your reading or other assignments in quiet areas, distraction reduced. But in terms of the core attention, it's more like vision, getting corrective lenses. And the medications can help with some of those attentional systems. However, and especially the stimulant medications, um, can also help with what one person described it to me is they buy me time. I see and hear the distractions, but rather than getting pulled away by them, I can notice them and refocus better. It's not perfect because you can still get distracted. We all get distracted, but that, being able to fend it off more and stay on task. And then something you alluded to, be more productive. Now they are stimulants, so a benefit of them is, and also with some antidepressants that may not be stimulants, but they have some sort of boost to them, is it also helps with energy and focus. And then the confidence that comes from, I can trust myself. I feel more reliable. If I sit down to work on something, there's more predictable cause and effect. If I devote an hour to homework, I'll get about an hour of productivity done. And when I study for the exam, I'm more confident that at the very least I'll pass the exam rather than before. I studied, I stayed up all night, but I still don't know, will I answer all the questions accurately? Now, what the cognitive behavioral therapy can bring to the table is even with effective medication treatment, it doesn't mean that we won't procrastinate. It doesn't guarantee the follow through. So somebody can say, hey, I'm focused great. I can read stuff that I really enjoy, but I'm still not reading the assignments. And some other things. So for my money, procrastination is one of the things that cognitive behavioral therapy can help with the most. The escape avoidance that usually comes from the frustrations of trying to do things with ADHD. That working twice as hard for half as much, or even if I put in time, am I going to get some reasonable results out of it? So I can put in a lot of time and effort, but I still don't finish, or I have to take an incomplete in the course. So, CBT can be helpful in terms of breaking down how we procrastinate, not, oh, you need to start earlier. I've used this line with you before and probably everybody else I've ever done a podcast with. I'll tell my clients, if we're working on your procrastination and all I bring to the table is you need to start earlier, sue me for malpractice, please. You know that, but how do you think yourself out of it? And it could be the pessimism, the frustration from having gone to school with ADHD and frustration, the emotions. I use the analogy of food poisoning, not the literal symptoms of food poisoning, but things that are supposed to be good. Oh, you should enjoy school or learning, or work's important. You got to earn money. We know that, but then if it's difficult, it's hard to focus at school or at work, or waiting to the last minute, or missing stuff and criticisms. Hey, your work is good, but it's always late. That stuff builds up in the negative mindset, but also the emotions, because emotions are a signal. And just like with food poisoning, the next time you try to eat that same food, what's going to happen? Let's just say it's sushi. You can't not feel nauseated the first time because it burned me before. But that's sort of what happens with tasks, related to ADHD. And then reacting with avoidance, including procrastination. I'll work on it later when I'm in the mood. Well, when are you going to be in the mood to do homework or work? I'm never in the mood to do those things, but it's how ADHD can make it harder. So often benefited, helped by medications with the focus, but helping with the engagement and realistic expectations. How long will you work on this? Stuff our grandmothers would tell us to do. But there are ways to break it down, as well as many of the other workarounds for executive functions like time management, organization, and maybe not part and parcel of ADHD, the negative thinking that can go along with ADHD. Emotional regulation is an executive function, but you don't see them listed anywhere in the diagnostic criteria. And then, like I said before, the avoidant behavior. So very often the combination of medications and cognitive behavioral therapy can work together. In some some people can get by great on medications alone. That's like getting the right eyeglasses. They go, got it. Now that this is working and I'm more confident, I'm getting to more things, everything gets bundled in together. But sometimes people either will benefit with the addition of CBT, and in rare cases for people who just do not respond to the medications, I'm taking them, but they're not working, maybe can't tolerate the side effects. The side effects are too strong. Like one of my clients said, who couldn't stand the side effects, but he said, best 2 weeks of my life. I could focus, but I just couldn't stand the side effects. And sometimes people just might have some sort of health condition that doesn't allow them to use the medication, or women who are pregnant or breastfeeding, where there's, and also some people by choice. So, in some cases, and there's some research to say that, CBT can be helpful without medications when necessary, but it's sort of like doubling down. It takes a little longer for the skills and the habits to get in place than when somebody's also taking medications at the same time.
Now, this is going to be a side question here, but have you seen a number of women that were on social pills or social anxiety medicine and other things? They start to lose that because of the fact that they found a right treatment for the ADHD was actually the core problem.
That's a great observation. Anxiety and depression are the top two coexisting features, emotional features with ADHD. And anxiety usually comes out ahead. And now, anxiety, we typically think about it as risk or danger, assessment of risk or danger. But there's another way of thinking about it and there's evidence for this, that it's the intolerance of uncertainty, which is part of risk.
Part of life.
Well, it's part of life. Yeah, the non-zero risk in life. So even though we know flying on an airplane is the safest form of travel, we can't 100% guarantee that this one won't come down. You're welcome to anybody taking a flight soon. But kidding aside, ADHD is an uncertainty generator. I know I can do it. I've done it before, but will I be able to do it now? Like even in school, sometimes people say, I did great on the test. I got an A on the essay that I put together, but I don't know if I can replicate this again. Maybe next time I'm pulling an all-nighter on the paper, or I hand it in and my thoughts are disorganized. So going back to, and one of the side effects of a stimulant medication is that it can increase tension or anxiety. But to your point, a woman or somebody else also in some social anxiety or other anti-anxiety medication, sometimes it would seem like, well, isn't this stimulant? Isn't that going to be like gasoline on fire? Isn't it going to make the anxiety worse? It can. That is a possible side effect. But a lot of people will say, once I'm more confident and I see, hey, when I sit down to do things, I can do them and get them done. That's usually what the anxiety was, that uncertainty, like, I don't know what's going to happen. But as treatment takes hold, and it can also be the benefit of CBT, as the positive changes take hold, and this is one of probably, being a helper is one of the most exciting and rewarding things to see, is all the things that would cause so much trouble and erode confidence and self-trust. Now somebody's growing more confident in, and not just getting things done, sometimes going, I'm actually pretty good at this. Or now I can get to it earlier. I don't have to pull an all-nighter. I don't want to oversell it. There's a whole continuum of change, but generally things, the medications and CBT are among the most effective treatments we have in general. At least with ADHD, the positive effects are among the strongest compared with everything else. But that long-winded way to get back to the question, yeah, very often, even with the medications alone, maybe the anxiety medications can be tapered off, and it's, just focusing on the ADHD can help with reducing the anxiety, because often it was that uncertainty from ADHD, and sometimes you can see the same things with depressed mood as well. And you want to be careful about it because, depression always also goes along with some at times with suicidal thoughts. So you want to be careful because sometimes both are required, and same thing with anxiety. But there are many people who for a long time thought it was the result of anxiety, that once the ADHD is medicated and otherwise treated, they go, I'm not as anxious anymore.
Before I leave the whole personal experience that this all encompasses, I want to talk about a parent with ADHD and a kid with ADHD. Do you see better combination if neither of them are on medication or any treatment, or do you see better treatment for the adult being able to take care of the child better? Because in a sense, I don't want to diminish the capacity here, but two of them are kind of childlike. One is an actual child, and one just doesn't has their mind in other areas. Doesn't mean that there might be emotionally stunted or anything like that. It just means that there's a different focus. And I've noticed that, and like I have a friend that has a kid. He has ADHD. His kid has ADHD. They both go to their rooms and do their own thing. I'm like, you have a kid, you should be hanging out. Your kid's like 7 years old. You should like be like, it's a formative year. He was like, he's doing his own thing in his room. I don't want to bother him. And I'm just like, you're both on your phones probably. Just go see each other. And now this is not just ADHD related thing. This is all
Right, right,
over. But I've noticed that there's a little bit more of a struggle with people that I know that are non-medicated or not seeking treatment, that are trying to raise someone that's a little bit of a lot of energy and a lot of, it's like kids are, but a little more so. And I feel like it would be a little bit easier for them if they had something assisting them or guiding them in a pathway to make sure that every priority is not just going to pop up at the last minute. It's going to be focused on ahead of time.
right. How I'd reword it, and like you said, you're being very respectful of both sides, but both the child and the parent have age-related executive functioning deficits. And just for anybody tuning in for the first time, we're really starting to think about ADHD. The core symptoms, there's a single list of 18 symptoms of ADHD, and they're not wrong, they're not bad, they're actually quite good, but they're incomplete because they don't capture the overall self-regulation piece, the emotional management, the time management, organization, things like that. And we all have these executive functions. There are self-regulation capacity. It's just with ADHD, it tends to fall on, they just tend to be, for lack of a better phrase, weaker for folks with ADHD, which creates like the lateness, the procrastination, things like that. So both the child and the adult have age-related executive dysfunction. Now, the parent, let's just say they're like 30 years old, they're going to have more, better executive functions than they did when they were 7 or 17, but it's still for a 30-year-old creating problems relative to somebody without those deficits. So they're, the executive functions will get better for the 7-year-old for the child, but it's still with ADHD. Again, this is why sometimes there are people who aren't diagnosed till adulthood. Maybe it's not till then that the problems really get to be unavoidable. Now, bringing that back to, I'm not sure how well this has been studied in a systematic way, but it would seem like that both both the parent and the child being adequately treated would make for a better parent-child interaction, just directly in the household outside of work or school. But then if work or school are going better and don't take up as much time between the next day of school, the next day at work, just from a pragmatic standpoint, we're not spending 3 hours on your homework, and then I'm not having to spend my weekend catching up on work at the office. also the emotional regulation, um, just being able to organize time and tasks together, being able to, which is an emotional regulation uh, feat for any of us these days, set our phone aside to go do something else. Yeah, it would seem like the parent-child interactions would be better, even though it would seem like that's a no-brainer. But yeah, I would agree with there would be more opportunities and the quality of it. I mean, it's still parent-child. Kids will get grounded, our teens will get grounded, and parenting is an endurance sport. It's hard, it's frustrating. There'll be still all the typical developmental struggles, the healthy ones, but still struggles. But
I would think deeper social communication as well too between the parent and the child, just because a parent who works two jobs just to be able to afford the house for their kid or something like that. When a kid comes with a problem, you hear the problem, but it's a child problem. It's not a adult situational problem. So for an adult that works two jobs and is barely getting sleep, listening to someone complain that a friend can't hang out tonight or something like that, to them, they might not treat it with the full emotion. But if they're being treated for ADHD, they might notice, because with ADHD, the social cues never usually get picked up sometimes. And that can be a big problem with communication between people with ADHD and people who don't have ADHD. So I would just think that would be probably a bridge that would get repaired there if we talked about the parent and child relationship.
yeah, that'd be another one. And also not to lose sight. I mean, we can set up scenarios because you raised a good one, and I'm glad you shed light on it. It's the parent working, the solo parent working two jobs, and in addition to the child with ADHD, might have one or two or more others who, even if they don't have ADHD, they might have some features or one, or just apart from any of that, they're just kids who also need time and attention, and they're going through school and all these different things. So there's all these things that can, one, make it even more challenging, even with effective treatment. But also sometimes there might be some situations where individuals in these situations might be a little more prone to have ADHD in the first place, which already is, making these things difficult. But like you said, the person to person communication, the parent to child communication, and part of the executive functions, the emotional regulation piece is, and why what's the emotional regulation piece for all of us? It's generally being able to flexibly flexibly adapt to situations, including those times that, as a parent, you're spent, but you go, this is my child. Let me rein it in. It's not perfect, but we can listen well enough and hopefully later on do our job. And we go, all right, I'm glad I did it that way, even though, and also for the parent, reaching out for support and self-care and things like that. And again, there's a lot of folks out there, struggling to make ends meet, and, multiple, just different family scenarios and dealing with other societal things that can add degrees of difficulty to anything, but, also with ADHD. But that's another benefit of treatment is, again, more flexibility and being better. None of us is perfect. The relapse rate for procrastination is 100% for everybody. And being frustrated as a parent, but you know, there's a lot of literature on good enough parenting, and it's not meant to lower the bar, but to say, there's a lot of different ways you can be there, and just even your presence is a benefit.
What about workplace development when it comes with adult ADHD and being diagnosed? What changes are we looking at when it comes to social engagement, career development, mostly people prioritizing things that they're maybe have been putting on the back burner for a while, because obviously with ADHD there becomes a lot of stress and fear and anxiety with where your life is going. And it seems like with treatments for ADHD or just medication for ADHD, it brings you a little bit more into the now, where you can kind of prioritize it and take it step by step appropriately.
Yeah, I think, and this would be also true of students of all ages, and again in the workplace, but follow through on assignments. Now, these could be homework assignments in school, but also work assignments. Um, Now, also with work assignments, there's a lot of, I mean, there's as many, workplaces as there are adults, where it could be like a self-employed contractor going around and doing work and keeping track of who do you see next and billing and all those things. It could be, working at an office where you have to do monthly reports, and there's a lot of like what's the phrase I heard? Head down work, or knowledge work. So generally across the board, treatments should lead to improvements, and not just for the benefit, like I said, the time savings, being able to get more work done at work, wherever that is. And very often there's things we do outside of work, but also just being more efficient in time and efficient for, first and foremost, for overall well-being, so we can get to bed on time and then wake up at a reasonable hour. Um, Now, all that, the ripple effects of that are probably being better able to, one, and these are all issues that are problems for individuals untreated with ADHD, keep a job, less likely to have to change jobs because due to um, whatever, not keeping up or getting released. I mean, some people choose to change jobs. Um, and also, one of the things, going back to the emotional regulation, you can be sort of disorganized and maybe late with things and get along well and still keep your job. But if you're oppositional, if you're difficult to, if you talk back to bosses, if you're defiant, that's the stuff that gets you fired, or also with coworkers or things like that. So that's another benefit of, talking about the relationships at work. And also that's an important part on maintaining functioning well within work teams or whatever you do, or customers. And also, that positive impression, that positive reputation that comes from, being a good teammate, if you will, and producing. And that can lead to, one, progressing, maintaining, including sometimes people saying, like I mentioned, somebody gets promoted to manager and they say, this is too many people. I want to go back to where I was before. Um, and also sometimes, and we'll see this in college students too, saying, you know what, this isn't the job I'll be best in. Doing these written reports, Excel spreadsheets. I get no money from, Microsoft from mentioning Excel. Um, but maybe I want to do something else. Or a student saying, I don't need a college degree to do what I want to do, or I don't want to do this major, and being able to figure out what's a better fit for me. That is sometimes from being able, more confidence in follow through, but also, I mean, other workers and students can come to that to say, you know, do do I really want to be in college, or do I really want to be doing this job? That can come from anybody, but I would imagine a lot of folks with ADHD are just trying to keep their head above water and maybe don't have the luxury to think through, hey, what do I want to do now? And that's, a good treatment might open up more options. But at the very least, hopefully being able to get through a day at work with more time for outside of work, and, maybe less worry about falling behind and losing a job.
Have you seen less resistance when it comes to looking for treatment with ADHD? Not necessarily the types of therapies and things that are available, but with medication. It seems like I'm noticing a lot more that there's been less stigma on the medication side of things, just because I think people are getting a more realistic expectation of what it is compared to what it's kind of been scared from. For at least a lot of mothers watching TV in the 90s were probably afraid of all these different types of drugs that were coming out.
Right. I mean, there's still negative messaging out there. I think I'll say it this way. I think there there have been some who have drawn an equivalence, and this is an important thing, uh, the opioid crisis, and trying to say, well, the stimulants are Schedule II, meaning that, there are certain, prescription restrictions on it, because it is abusable. Um, but what we know from the research, generally, now there's a new study that was raising some issues that I haven't read yet, so I'll acknowledge that there's maybe a counterpoint to this. But there have been several recent studies over the past couple of years showing that taking a prescribed stimulant, including starting in high school and later on, it doesn't raise the risk for addiction any more than anybody else in the community. So it's just as much chance as anybody else. Now, I'm a clinician, so every story is different. Is there a family history? Have you abused stimulants before or some other medication? Well, that's different. And that is factored into everything. But bringing it back, apart from that, and there's still some negative messaging out there, in a weird way, I think the stimulant crisis and some of the stories, the media stories on that, and that included the stories of people describing, the benefits and the need for it, I think put a face on it. And also with the pandemic and lockdown, because in the course of the pandemic years, there was an upsurge in adult ADHD diagnoses. In fact, I think it was the number one increase. Um, but with the pandemic and lockdown, people all of a sudden, one, not having to go into work or school, had more discretionary time for seeking out help. For many people, the demands, now lockdown was an adjustment for everybody, but most people made it. But people go, oh my gosh, I still can't, I'm still falling behind in school and work, even if I don't have to go to the office. And there was also greater access because some of the state licensing for, I think it was true of physicians, psychiatrists who could do this prescribing, but very much so for psychologists who were generally limited to their state of licensing in terms of practicing. Now people could practice virtually across state lines. Now that has been shrinking back a little bit recently, but all of a sudden a lot more people were able to get out there and be seen, including getting medicated, and both them and usually what makes a difference is the loved ones around them noticing the difference and having the buy-in for, and we've known it for a long time, but like ADHD is real. And I think there's probably still underdiagnosis, but it's getting better. And I think the other limiting factor though is with the access, ADHD is still pretty much a niche specialty because it is not a standard feature of graduate education in clinical psychology, nor for generally adult, medical students who want to be adults, treating adults as physicians, including adult psychiatrists. It's getting a little bit better. Well, it's still not a standard feature. So I'm hoping that's the other thing when the US guidelines come out, that will also allow people getting future healthcare professionals and mental health care professionals feeling competent in being able to make the diagnosis and provide treatment. So that's another limiting factor. But I think more people are appreciating that, the medications are medications. You take them seriously. Be mindful of side effects, health issues. But they're taken as prescribed. They're among the safest and most effective we have. And again, I'm a psychologist, not a prescribing physician, but this is based on the literature.
Based on like the past 6 or 7 years that ADHD has been more recognized and there's been a lot more research on it, how slow or how far back do you think we are right now when it comes to research with ADHD? Obviously, there's a whole slew of articles you can find, and I'm coming across more and more of them every single day. But obviously, there's areas that haven't been covered. I think we've talked about rejection sensitivity because that's been on popping up on social media. People have been resonating with that. But we're catching up in a sense of that it's becoming a little bit more acknowledged and that word is now being more common name.
Right. You know what? The research, and I'm also heartened seeing, at least within my field, like when I'm doing a literature search, seeing a lot more dissertations focused specifically on ADHD and adult ADHD. So I think there's positive movement, generationally. So I think the research is good, but we can always use more research because, like I said, we know about the coexisting factors with ADHD, and part of future research could be, all right, let's just focus on cognitive behavioral therapy for people also with anxiety, and let's see these more nuanced presentations, parent-child interactions. I think there's some work on that, but can always use more. Now, at the same time that, I think ADHD is out there and more people have better awareness of it. At the same time, there's a lot of misinformation. There's some that are patently wrong and trying to, for lack of a better phrase, vilify ADHD. There's also probably some well-meaning things on social media, and I'll call it out because there's data on it's patently not helpful for the most part, TikTok videos. Um, and so there are some things that are held up as ADHD, and people with ADHD might. I think I saw something recently, and I'll say this respectfully. Um, oh, what was it called? Like it was some sort of laundry problem where it's like laundry is left unfolded or in the laundry baskets, whatever, and never gets around to getting folded and put away. And I don't know if there's any evidence on this, but I would imagine, yeah, that's probably not an uncommon thing that my clients would say, yeah, I still don't get around to doing this, but now it's held up as a symptom of ADHD. And that would be an empirical question. Does it occur more likely? Because there are some things that are no different between individuals with ADHD and not, such as having difficulty getting started on work that's not inherently interesting. So that is something that's across the board. Now, there's other examples of not being able to follow through and complete homework or tasks for the office job, where those are creating impairments and are more likely for folks with ADHD. But some of these other things are just misrepresenting, ADHD, even if it's trying to shed light on it more. But it also sets the cause. I don't want to say the cause because this isn't something that it's a movement. This is a disorder, um, in terms of falling at the extreme problematic end of what is a human capacity, the executive functions, the self-regulation, but also the core symptoms. It's dimensional, which means the other thing clinically is, let's just say somebody falls one or two symptoms short of a formal diagnosis. They still might be having a lot of problems. And, for individuals who might just go by a symptom count, they go, oh, it's not ADHD. Well, you're right. It doesn't meet the official diagnostic criteria, but it still might be causing problems. Just like people can have subthreshold depression, subthreshold alcohol abuse, where it's still causing problems and worthy of clinical treatment, psychosocial or medical. Um, so that's important to, it's not like, do you have it or do you not? I mean, that is a little bit. And also remembering that not just the symptoms of ADHD, but these are making a direct and causal contribution to life problems in at least two areas of life. Now, I would make the argument if you're losing your job from adult ADHD, but you get along with your family and with other people and you're well liked in the community, losing your job is enough impairment. Now, there might be something about the job or the boss to tease apart, or like on the other side, like a child with ADHD, if the parents are divorcing and there's stress at home, you want to look to see if there's other things going on. But, bringing it back to, I started off on the medication piece. So I think more people have a better understanding of the benefits of the medication and the need and the effects of the shortages. But there's still some unhelpful information out there. I'm all for a good research-based discussion and weighing pros and cons of things, but there's just a lot of patently wrong information still out there.
I want to ask you about the type of terminology that you use. You're very careful in the type of language, and I'm guessing that coming from a sense of empathy to not shame any types of people that might be suffering from. But you mentioned not disability when you spoke about ADHD. Do you classify ADHD as a disability? Because I've never ever considered it that. I definitely think it can be a hindrance in types of certain formats, educational and stuff like that. But I also think that word applies a certain stigma to people that might have ADHD, and I wouldn't want to be classified as someone with a disability.
Well, I'll take it this way. Using the Americans with Disabilities Act. Now I can't cite it chapter and verse, but it is about fair and reasonable access. So this could be ramps. So somebody in a wheelchair or other mobility issue has access to a building, both entrance and getting out if need be. Access to information such as that can help with somebody with auditory problems or visual problems, other ways to present things that, are, things that don't get in the way of the core aspects, the core role, the core job or learning, things like that. And so with ADHD, it can be classified as a disability using the Americans with Disabilities Act if, say, um, within an open office workspace, and the open office layout is a colossal failure for everybody. But if an accommodation would be, can I go into this extra office and close the door when I have to do work and not be distracted? That would be an accommodation. Now, it might be clumsy that we say, do we have to make that a disability? And I think a lot of things that before would have been accommodations, like voice to text software, if somebody has, and some of these could be learning issues or other related issues that go along with ADHD, like dysgraphia and being allowed to use a keypad, or voice to text software rather than having to write things. Now these are common staples in the word processing software and what I'm trying to avoid brand names. So yes, yes. So from a legal standpoint, it can be a disability. Um, and many people might find it off the legal side disabling in some ways, or at least very, very difficult, quite impairing. But yeah, just like ADHD is dimensional, or I mean, the executive functions are dimensional, and the symptoms of ADHD are dimensional, with some people having zero of them. They're annoyingly organized or time management. They're the person you want to be your personal assistant, or schedule your vacation for you or do your taxes. Um, but even within ADHD, there's a dimension of people who go, yeah, this makes everything a little harder, but I'm generally getting by. I'm not in danger of getting fired or dropping out of school, or like evaluations I do. Hey, I graduated in 4 years, graduated high school on time, but man, it was a grind. And now work's getting harder. But there are people in there, and very often complex cases, mood, anxiety, learning differences, including stuff like, oh, and I have diabetes too. And I have to manage that and remember to, you know, take my insulin every day or whatever. So there are multiple complexities, as well as risks for being under or unemployed, or various other things that can just make things more complex. So maybe if ADHD is in the picture, it may not be the main disabling thing. It can go along with other things, just like somebody in a wheelchair who has ADHD. But itself, with nothing else going on, depending on the circumstance. And again, a lot of workplaces these days, I think, would be pretty accommodating. Like, okay, if you need to put earbuds in and listen to white noise or instrumental music when you do work, yeah, go ahead. Because a lot of these things would benefit anybody. So hopefully it's just um, this is making it more, just finding out what helps everybody be more productive or whatever, and overall well-being. ADHD might be ahead of the curve a little bit, but when for formality going back, yes, it can be considered a disability within the Americans with Disabilities Act, depending on the circumstances.
Dr. Ramsay, I appreciate the time you gave me to talk on my show about a lot of these things that we discussed today. I know I didn't give you a heads up on any of the stuff, but you gave me some really good answers and some kind of areas I needed kind of covered.
No, I always appreciate this because you're asking a lot of questions a lot of other people want to ask. So hopefully it gets out there, and appreciate your insights and your preparation and your professionalism, and you just being forthright, because it's what, this is one of the down things about TikTok. And there have been studies on it, including a most recent study that don't listen to TikTok. Um, I'm sure my computer's going to get hacked now somehow, but no, kidding. Um, but one of the things it has going for them is, the main thing is that grabs people is personal stories. So that's where, even if it's sometimes it's misinformation, but what grabs people, and what you're doing is giving, and sometimes people might be authentically trying to do things that they go, this feels like ADHD, but you're really sharing yourself and putting it out there. And I think it'll help a lot of people, because hearing somebody going through it, managing it well, and honestly and authentically, but open about it, but also achieving, I think is a great role model, and hopefully, this and other things that you do help out a lot of people.
Can I get one source recommendation for articles on ADHD that you would recommend to anybody out there listening? And then can I also get your links?
I'll start with that one. The best way to find me is my website, www.cbt, as in Thomas, number four, ADHD.com. Man, a single article.
Or just Source Guide, ADHD magazine or anything?
Well, you know what? For Attitude magazine's not a bad first start for a very popular overview of ADHD. And disclosure, I'm on the scientific advisory board of Attitude, but I get no money from it or anything like that. They also have very good webinars, leading experts doing things that you can log on for free, or if you can't make it, you can get the recording later. Um, a nice source of evidence, the research on ADHD is Steve Ferrone. He's a very well published, a leading expert
Past
on.
guest.
Oh, good, good, excellent, and the president of the World ADHD Federation. He has the ADHD Evidence Project. So it's this website where he reviews recent studies and both the things that say, hey, this is, about ADHD, this we thought caused ADHD, but it doesn't seem like it does. And it's just a nice up-to-date resource that I use a lot. And I think he published a recent guidebook, a very small, concise guidebook about how to do ADHD. That's Jessica McCabe's book, or website, sorry. But it's like, how do you go about getting the diagnosis and follow-up treatment? A little educational guide that all proceeds go to fund the Evidence Project.
I'll link those links in the description. I know exactly the one you're talking about as well, too. Dr. Ramsay, I appreciate the time you gave me to talk on my show. Thank you, everybody, for listening to this episode of Out of the Blank podcast, and stay tuned for our next episode.